Hello, everyone. Welcome to my patient education YouTube site about knee replacement. It correlates or pairs with a book I've recently published, Proactive Approach to Knee Replacement. My name is Dr. D.Graybill, and today we're going to discuss some non-surgical treatments. There's quite a bit more detail in my book, which is available on Kindle, Apple, Barnes & Noble, and published by BookBaby. An interesting thing about this, I'm currently on Kindle #1 in orthopedics. It's only been a few days. I don't think there's a large amount of sales, but at least the book and material is getting out there, hopefully to help some patients. Moving onwards, there are a number of non-surgical treatment options. I'm not going to discuss them all. There's a detailed list in the book with data about certain impacts, literature references, which I'm not going to go through really in the video itself, at least not in detail. In any event, let's move onwards to one of the two topics I'm going to discuss today. So again, there are many options for treatments. The probably most common traditional medical management, and I'm sure everyone's really aware of this, is oral anti-inflammatories. There are many of these medications out there. Many are prescription, many are now available over the counter. They all have fairly similar mechanisms of action, although they have different effectiveness in individuals, and they also have different side effect profiles, both in general as well as in individuals. So it's very hard to predict, at least in my experience, which medication will be most effective for a patient. Over-the-counter medicines which are commonly used are Advil, which is an ibuprofen, and Aleve, which is a naproxen compound. Both are widely used, perhaps too widely used. We'll get into that in a little bit. But they reduce inflammation. The side effects are probably are widespread, but the common ones discussed are stomach irritation, even ulcers, as a negative side effect. And the second would be kidney issues, which are exacerbated by low hydration and by already having some kidney function issues. Thirdly, this is not recent, but a more recent association has been with cardiovascular disease. And I don't think that's really well quantified at this time, but cardiologists would recommend caution if you have any pre-existing cardiac problems. So, moving onwards, advantages. So the advantages of oral medications are obviously they're easy. You can take them kind of whenever you need them or daily. They're widely available, and they're fairly safe, and they're certainly safe for most patients in short-term use. They do help multiple areas of your body. So let's say you have, hand arthritis and knee arthritis. You take the oral medication, and you'll be treating both areas. Same would be true of some back discomfort or other combinations. Again, there's many types, so one of the advantages is if you have side effects from one, there are alternative medications you can try, which may have a better, profile for an individual patient, which is really why there's dozens of these medications available. So I think they're effective for many patients. Like all non-surgical treatments, they are far more effective earlier in the course of disease. In other words, if you have mild arthritis, anti-inflammatories are almost always effective. And when you have very severe arthritis, anti-inflammatories are very infrequently highly beneficial. And that's true basically of all non-surgical treatments, independent of the type. Moving on, there are disadvantages. I briefly mentioned some of these. Number one is you can get stomach upset and even ulcers. This appears to be related to the general susceptibility of a patient in addition to the length of usage. So if you use these medications very infrequently, you're pretty unlikely to get an ulcer, whereas if you use them daily over months to years, that risk accumulates. The second risk, and one I think is probably more significant, is kidney damage. There's something called the GFR, which is a test on kidney function, and it has been shown that if you have diminished GFR, these medications are far riskier at further kidney damage, and it is also fairly likely that long-term use does increase the risk of kidney damage itself. As I mentioned earlier, staying well hydrated is somewhat protective. If your GFR is below 60, I would not recommend taking anti-inflammatories even occasionally. And if you have a lower than normal GFR, I'd be very cautious with taking any of these kinds of medicines. And lastly, as we discussed, there are some cardiac risks, which I think is more within the cardiovascular literature, but is significant. There are two general categories. One is the general non-steroidal anti-inflammatories, and then there's some specific, which are called COX-2 specific. Celebrex would be the brand name of the predominant COX-2, and it may be a little bit safer on stomach issues because of the pathway it inhibits. But again, I think caution with any of these medications over long-term use. So again, we'll move on. Here I'm going to explain my opinion on this. Historically, anti-inflammatories were the first line of treatment. Patients were placed on them long-term. I don't think that that's a good use or a case use for them. I think if you're having to take anti-inflammatories every day, the risk profile probably isn't very favorable. And my best use scenario is for flares of arthritic pain. So let's say you have a moderately arthritic knee, baseline isn't too difficult to manage, but you did something, the knee pain and swelling increased, and you use an anti-inflammatory for a few days, a week, maybe two, to settle it down, and then you get back off of them. I think that's a much safer use of anti-inflammatories. That's my favored way to recommend them to my patients, because again, I'm worried about the long-term risk of oral medications. There are many other things that can be used, and I think if you've moved on to requiring daily anti-inflammatories to manage your knee pain, you probably should look to something else, maybe injections, etc. Okay, so that kind of summarizes my thoughts. Again, that's my opinion. Other doctors still recommend regular use, but I would be cautious with that. And I moved away from it personally with my knee arthritis many, many years ago and adopted the approach I just described. So my second topic, again, there's several others in the book, but one I think is important is activity level. So let's assume you have a significant arthritic knee. And the question is, how active should I be? What should I stop doing? What activities should I continue to do? And does my activity level impact when I'm going to need a knee replacement? So my thought on this is probably different than most patients approach it. I think most patients kind of assume that, I've got a significantly arthritic knee, I want to delay my surgery. If I'm less active and it hurts less, that's going to let me delay my knee replacement by several years. That's kind of a common assumption. I really don't think that's true based upon my experience in the literature. The progression of arthritis is, I think, a little more random than that. I don't think it's correlated directly to how many steps you take. I think as long as we're not doing overly aggressive activities like taking a very arthritic knee and deciding to continue to run marathons, I think that probably isn't in your best interest. There is a concept of homeostasis, which kind of means balance. If you are performing high-level activities that move well out of your knee's comfort zone and you have weeks of resulting pain, you're probably accelerating the process. On the other hand, staying moderately active, i.e. doing a lot of walking, biking, elliptical, treadmill, that type of level of activity probably does not impact the rate of progression. It may actually be somewhat protective in a few different ways. And I really think that it's unwise to pursue a high level of inactivity and reduce your activity levels, as those activity levels become very hard to get back to. So here we get into too much I kind of described. I think, you probably shouldn't be playing competitive full court basketball on a severely arthritic knee. You probably shouldn't pursue long distance running, but maybe some running, some cross training actually is beneficial. To go on the too little side, my knee hurts, therefore I'm going to walk less, I'm not going to bike, I'm not going to be active, you become too sedentary. That affects your physiology, your metabolism, your weight, and your muscle mass. It's extremely important to maintain muscle mass as we age. Arthritis interferes with that potentially. So we want to get a balance of activity, which I title here Just Right. By that I mean you want to make sure you can get up and down from a chair easily, walk good distances, perform some level of exercise, both aerobic as well as weightlifting activities. Those things are very important as we age. And you should not let your knee get so bad that you can't do those things. Or after your knee replacement, you may not be able to get back to a healthy level of activity. So I think that's probably the most important part of this activities and arthritis discussion. Maintain good physical condition and activity. Do not let your knee or other joints get to the point, despite medical management, that you can't maintain a good activity level to do normal things. Walk a good distance, shop, get up and down from the chair, climb stairs, descend stairs, perform normal activities to maintain a good, healthy lifestyle and metabolism. I think that's absolutely critical. One mistake I've seen many, many patients make is they keep trying to delay their surgery and fall into this trap of their activity levels capacity decreases too much. We do not want that. So again, referring back to my book, title is listed here for an extensive discussion of other non-surgical topics, as well as many others. I reference this book. It's available on Kindle, Apple, and Barnes & Noble, as well as many other sites. I encourage you to pair that with this talk. I think you'll get a lot more out of it. I'm hoping this video series supplements the book. And if you are considering knee surgery, I think there's a lot of information both on this YouTube site as well as the book, which can be very helpful to you. So I hope everyone has a very good day, and we'll move on to other topics gradually, and I'll continue to populate the site for a while. Thanks, everyone.